Does prostate play make you gay?
First of all, nothing that you do is going to make you gay.
Right.
This is a very common question, but
No.
playing with your prostate, stimulating yourself to your maximum sexual capacity does not make you anything but you.
Welcome back to another episode of Spilling the Tea with Gabriel
And Tyler.
and Tyler. We're back again for
back again.
more
More
questions,
questions.
more interesting facts about science and sexual education.
Nice.
Right? That's our favorite topic, sex.
You know, it's a understudied, overlooked
Yeah.
topic in the medical field.
And taboo. No one wants to talk about sex and no one wants to share information. It's like
It's tight.
secret.
Secret.
Tight. I like
Yeah.
that. Very tight.
Very tight-lipped.
Speaking of tight, today we're talking about anal sex and our prostate today,
That is a very tight subject.
also known as the G-spot.
The G-spot is typically found in females.
Wait. So men don't have a G-spot.
Men technically is no G-spot. There's no such thing as some sort of idea that was created probably by a guy. Guys are always making ideas, especially about women. That's another topic for another day.
Well, now I'm curious.
There's no G-spot. But there is a prostate. So let's dive into that.
Okay, so let's talk about the P-spot, right?
You can call it that.
So what is the P-spot?
So the prostate is a gland found below the bladder and in front of the rectum. Okay, it's a very important sexual gland for men. Specifically, it's responsible for creating seminal fluid, which is important for ejaculate to help us reproduce. Without the prostate, we wouldn't be able to have babies. So it's a very
Wow.
important organ in that capacity, but it also has a very important sort of roadway that runs right through the middle of it, and that is our urethra. So when you urinate, that urine has to go through your prostate, so we need to make sure that it stays healthy so that we can pee regularly.
Yeah. That's important.
Peeing is important. If you've ever not been able to pee or had to hold your pee too long, you know it can be very important to be able to release that. Yeah, and as we get older, oftentimes our prostate gets damaged. And so it becomes more difficult for us to keep a steady stream because the prostate starts to invade that urethra. So that little strip that goes right through it to help us pee starts getting occluded because our prostate gets a little angry.
That's just because of age.
It's just because of age. So we do think that in general, the prostate is stimulated by something called dihydrotestosterone, DHT. We've talked about it in previous videos. So testosterone gets converted into DHT through an enzyme called alpha-5 reductase. That then creates the DHT, which has two main responsibilities as an adult. Number one is it can promote hair loss, so it can make you lose your hair. Number two is it can make your prostate grow. And unfortunately, that can cause something called benign prostatic hyperplasia, BPH. And that growth, because it doesn't have much place to move, it's tight, right in front of your rectum, and your urethra is going right through it, it can cause damage to the urethra, which is why some men end up having to wake up a lot of times throughout the night to urinate. Specifically, we see this in like the 60s, 70, 80-year-olds, but sometimes it can be earlier too. I wake up every night to pee, and I have no problems with my prostate. So please, if you're out there thinking, I wake up to pee at night, no, I just drink too much water.
Right.
So it's not that, but
you had a big watermelon.
yeah, the main symptom patients are gonna, yeah, you're right, watermelon.
That took a minute.
Yeah, it did. The main thing patients with prostatic issues that are urinating frequently are going to feel is that they can't empty their bladder all the way. So they go often and will only urinate a very small amount. And that's because, again, that output of the urine is getting occluded by the prostate.
So why should we care about the prostate?
Right. I haven't really mentioned anything that's important to me or you because we don't have kids, we don't want kids, and we can urinate okay for now, right? So when thinking of the prostate and how it affects us or maybe other people out there, is it actually is a pleasure center.
Ah, really?
Yes, there is a lot of pleasure to be had by stimulating the prostate. And this can be for any type of relationship. That could be for relationships that I'm in or you're in.
Really?
Or anyone out there can benefit. You can even benefit from self-pleasure by touching your prostate.
The more you know.
The more you know.
Had no idea.
Mm-hmm.
Wow.
They don't really tell us that in school, or our parents don't sit us down when they do the birds and the bees talk. They don't really mention the prostate much.
No. They should.
Taboo. I think anything with the anus is quite taboo when you think about it. So
I mean, anything that is sexual related, it is a taboo. And
But I think on the list, the anus definitely is the bottom of the list. Some people don't consider it a sexual organ, right, or sexual function to be.
It's always a bad thing, right? To put your finger in your ass. It's like considered to be a
I feel like
culturally,
sometimes with these talks, you have to laugh. Like you have to just like take it
like
lightly.
culturally, if I did this, what does that mean?
Up yours.
So it's a negative thing, right?
I had no idea that
right.
that hand gesture had anything to do with the anus, to be honest with you.
Really?
Yeah. But this is new to me. I mean, it definitely is the perfect link.
Right.
If you're trying to reach your prostate, first step, you want to wash your hands.
Good.
You want to grab some lubricant.
Yeah.
You want to generously apply it to your middle finger. And then you need to probably be laying on your back, I would assume. But you could do it standing up. But that finger, you want it, the nail part facing behind you. True. And the skin part facing sort of your belly button.
I can see.
And then as you're about 2 to 3 inches in, you're going to notice a walnut-sized gland that is smooth and a little bit firm. And you may notice that when you press on it a little bit, it kind of feels like you have to pee. That means you have found the right place. And if you notice, if you play with it or rub it, you may start to feel aroused, which can be very beneficial for men, whether they struggle to get an erection. Some men actually will stimulate the area or have their partner do so because it can help actually the blood flow enter your genitalia easier.
Wow.
And
so you can get
erection.
hard from prostate stimulation.
You absolutely can get aroused and erect from prostate stimulation, whether you are getting that from a male or female partner.
I see.
Yeah, you may have heard some girls will say that their gentlemen enjoy a little finger here and there. And that's typically what they mean, right? Yeah. There is a huge pleasure center that a lot of men avoid because, again, taboo. Yeah. It is in the rectum, so you do need to be prepped and ready to enter that space. So it can be overwhelming. And again, we're not taught these things, so ignorance is bliss. And
so why does that stimulation feels good?
Good question. So it is a highly innervated and highly vascular area. So when we think of the vagina, we think of the lips, we think of the mouth, we think of the penis. There are billions and billions of nerve fibers that are ready to receive sensation, specifically pleasure in these areas. So that's the other question, right? Some people say, well, if God intended for it to be blah, 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 why is it there? Well, God put a lot of nerve fibers and a lot of blood vessels specifically designed to create pleasure on that organ. So, or evolution, or whoever you believe. So it was designed to create pleasure. And so there's some science backed to reasons why we need to put some attention there.
Can you have stronger orgasm when you stimulate the prostate?
Yes, actually. So that's why some men, especially if they're having trouble having an erection or reaching climax, will use a prostate massager or they'll use a finger. But yes, that penetration or even stimulation of rubbing can help you to have a more satisfying and explosive ejaculate. So, if that's what you're looking for, you've come to the right place.
You really know how to sell this, right?
I've talked about this a little too often.
Mm-hmm. It's a passion.
It's a passion for sure.
So I think the secret is be gentle, go slow, and lots of lube. And
the main thing is, if all of this sounds foreign to you and scares you, you're not quite ready to enter. You're not quite ready to rub the prostate.
You have to be ready for the prostate.
Yeah, and there's no pressure. Maybe it's not for you. Maybe this is not your thing. But I don't know how you found this video if this is not your thing.
And you made it this far, so yeah.
So you assume this is your thing.
What can go wrong with the prostate?
Right. So there are 3 main things that we would consider as the general main issues that can happen to your prostate. Number 1 is something called prostatitis. So basically inflammation of the prostate. In general, the treatment is antibiotics. Sometimes milking the prostate can be appropriate as well. You want to talk to your doctor to make sure that they approve that, but literally massaging the prostate.
So milking the prostate is massaging the prostate?
Yeah. So again, the prostate is responsible for releasing this fluid that helps to support the sperm and reproduction. So if that fluid gets congested, right, it gets backed up because maybe you're not ejaculating enough, maybe you're not, paying enough attention to your sexual health, that can make the prostate a little angry, right? Yeah. It gets full of fluid that needs to be expelled. And so you will probably be told to masturbate, to ejaculate, and to rub your prostate. I will say most doctors, when you come in with prostatitis or issues that could be remedied by rubbing your prostate, are probably not going to tell you to do so because it's taboo.
Yeah.
It's not something that you would expect your doctor to tell you.
Yeah.
And, you know, it puts your doctor in an uncomfortable position because they don't know how you're going to respond. So
Yeah.
I can guarantee that most people are not going to get that advice from their doctor, and you should talk to yours before deciding to treat yourself in that capacity. Prostate massage is not going to fix all prostate problems.
Would you, as a doctor, give that advice?
You know, I probably wouldn't, honestly,
Yeah.
only because I would tell them to go see a urologist first so they can
Right.
make sure that they had the correct imaging
True.
done. But I practice medicine in a very defensive sort of format. I like to make sure that we cover all the bases to ensure that nothing is getting missed. So if you come to me, I'm going to tell you to let's be very thorough
Yeah.
with what needs to be done. And I also see patients virtually, so I
Yeah.
wouldn't be, sort
Yeah.
of doing a prostate exam on them. Typically, your doctor is going to perform a prostate exam on you and then show you how to proceed with the correct sort of technique if they're going to recommend a prostate massage, which again is the reason why they're probably not going to do it in the first
Yeah.
place.
Have you gave a prostate exam?
I have given many a prostate exam.
Really?
I was in a urology rotation and residency where you do urology for a
Oh,
solid
wow.
month. So I was doing probably 10 to 12 prostate exams a day.
Wow. You're an expert.
I guess. I probably have done more prostate exams than most people in any given room. So yeah, I'll say I'm an expert.
What is the difference between prostate stimulation and anal sex? Is there a difference?
Right. So anal sex is going to be the consensual penetration of the anus
Right,
by
right.
two
We learned that
adults
before.
who've
I
decided
remember.
that they'd like to
Mhm.
take that path. Prostate stimulation doesn't necessarily have to involve any sort of penetration, especially with another partner. You know, prostate stimulation can be by yourself, can be with a female, can be with multiple people, whatever you're looking for. But simply, the difference is prostate stimulation can be with a finger, a device, massager, a partner, and then anal sex is going to be more penetrative intercourse.
Mhm.
Yeah.
They're
So
similar cousins.
yeah, both can. I mean, anal sex can cause prostate stimulation, but you don't have to have anal sex to stimulate your prostate. We talked about prostatitis. The other one, which we are kind of already talked about, but benign prostatic hyperplasia,
Right.
BPH, is a common prostate concern that men get as they get older. The prostate starts to get larger and doesn't have a lot of room to move, so it starts to occlude the urinary system, which can then cause frequent urination and inability to empty out your bladder. So you always feel like you kind of have to pee, yeah, which is not great.
Yeah.
And there's medicines that can be used to treat it. But what we do know, and there is some data to support, men who have sex more often and who ejaculate more often are at a lower risk of
Really?
developing benign prostatic hyperplasia.
That's the secret. Keep
Yeah.
masturbating.
Yeah, I
keep
mean,
having sex.
masturbation is very easy, very simple, can be done in less than 2
Anywhere.
minutes.
Mhm.
Pretty, convenient, flexible, can do it anywhere, and it actually has quite a big amount of benefit. You should not be going too many days without releasing the fluid in your prostate.
Some people say that masturbating often is not healthy for you. Is that true?
Yeah, so there was this large sort of promotional idea. I feel like it's called like no fap or
Right.
like no
Yeah.
hold on to your
Something like that.
something like that. So there was a study done that showed if men hold or prevent themselves from ejaculating for about 6 to 7 days, they should see an increase in their testosterone values. But beyond 7 days, the testosterone values go back to where they were before, and there's no added benefit. So some men were saying you should hold it for 30 days because then you're going to really see a dramatic improvement in your hormone production. And there's just no data to support that. So don't do that to yourself. Not only is that going to cause psychological and mental strain, but physical strain on your prostate. It needs to be released.
More often than 7 days.
Yeah, I would say 7 days is too long. You should
I see.
probably be releasing every couple to few days.
Can playing with the prostate actually prevent cancer?
So the data out there is very slim because, as you can imagine, most scientists
Of
are
course.
not interested in studying
Yeah.
sexual stimulation of the prostate. We do have an idea that, in general, regular prostate release, prostate stimulation should, in theory, reduce the risk of prostate cancer. But prostate cancer is also multifactorial. There can be many causes. So we can't say that there's a direct relationship, but it certainly shouldn't hurt as long as
Yeah.
your prostate's healthy.
So keep your doctor's appointments and your bedroom appointments.
Yeah,
Yeah.
I love it.
Yeah.
Just be scheduled into your appointments.
Does prostate play make you gay?
Well, no, it doesn't. So
Really?
there are many straight men. There are many, well, let me just rewind that whole answer. So first of all, nothing that you do is going to make you gay, right? There's nothing. You're either gay or you're not, or maybe you don't identify with that. So this is a very common question, but how you identify has nothing to do with your prostate and what you like to do with your prostate.
Yeah.
So in general, no. Playing with your prostate, stimulating yourself to your maximum sexual capacity does not make you anything but you.
So you can be straight and play with your prostate.
Yeah, many straight men enjoy prostate play with their partners or even alone. So if you're not comfortable doing that, you're just, missing out on the extra fun that you could be having with a sexual organ that is just right there waiting for you.
And many gay men might not enjoy prostate play.
You're exactly right. Yeah. So again, it's not just a gay thing, and it's not just for gay men. Many gay men prefer to avoid, anything back there as well. But again, you just miss out on an extra organ that is designed to give you pleasure.
Designed to give you pleasure. That sounds like a slogan.
Hey, I didn't make it. It was God, the universe.
Only older men need to worry about their prostate.
Well, unfortunately, most of the time, older men have to worry about their prostate because it becomes an issue for them as they age. Ideally, younger men would be more aware of their prostate health so they could avoid it becoming an issue as they get older. So what our goal is that younger people are aware they have a prostate, how to keep it healthy so we can reduce the amount of instances that we're seeing as we get older with prostate disease, prostate cancer, and things on the like.
So I think the bottom line is massage your prostate, more orgasms, and less stress.
Yeah. I mean, why not have a better orgasm than you're having right now with your partner? You can just throw something in there, stimulate it a little bit while you're getting busy. And that's the great thing too. You don't necessarily have to keep your finger in there. You could put a toy, turn the toy on, and then you can have intercourse with your partner and you're getting pleasure from all sides.
Wow. So yeah, I think you answered all my questions.
Wow.
All my topics and my misconceptions.
If you are curious about your prostate health and you're having prostate concerns, talk to your doctor. That is what they're there for. It's not always a comfortable conversation, but your doctor is responsible for making you feel comfortable. So remember that when you walk in, it's not your responsibility to make your doctor feel comfortable. It's theirs to make you feel comfortable.
Thank you for making me feel comfortable.
Yay. It's my pleasure. Thanks for joining me.
Thanks for joining us. This is such a pleasure talking to you about those topics. They're very lightheaded and, it's fun.
Lighthearted.
I always say that.
No, it works.
I never learn.
These are very lightheaded conversations.
See, I need to go back and
I think
read
you're doing
all
fine.
again.
You're doing fine, sweetie.
Thanks again for watching. If you haven't yet, please like this video, subscribe to the channel, comment, share with your husband or wife or
whoever.
anyone who's out there listening.
Cousin, nephew, neighbor,
partner,
teacher, doctor,
partner, boyfriend.
partner.
Thanks for watching.
See you next time.
See you next time.
Bye.
Bye.